So we're going to talk about tarsal tunnel syndrome. Tarsal tunnel syndrome is, in our observation, a fairly common syndrome that involves the nerves in the ankle. Most people are familiar with the carpal bones in the wrist relative to carpal tunnel syndrome, a fairly common condition. Tarsal bones are the kind of the same bones that are in the ankle. There's multiple bones down there, and there's a nerve that runs through them. And that nerve can be irritated, and it can create a lot of symptoms that frequently, for some reason, are not diagnosed maybe as well as they should be. We here at Power Health, we do a lot of chronic pain, chronic conditions. I do functional medicine. Dr. Gates is a board-certified chiropractic neurologist. We also have a chiropractic practice. Both of us are chiropractors. I'm a chiropractor for 34 years. So we've seen a lot of people come in who have had tarsal tunnel problems relative to being poorly diagnosed, relative to somebody saying, well, we think you got a sciatic nerve problem, and that's what's causing the sharp shooting pain in your ankle or in your feet. But we'd like to talk about it more relative to the peripheral neuropathy patient aspect of our practice. As we have peripheral neuropathy is a situation in which you come in and you have a variety of different symptoms, possibly because you have a lot of different nerves in your feet. Peripheral neuropathy is a pain, numbness, burning, maybe sharp shooting pain in your feet. A lot of those different nerves and different symptoms are coming from different symptoms are coming from different nerves and different mechanisms, and they needed to be treated as such. So we'd like to clear up some of the confusion. It seems like we get a lot of confusion with patients that come in here. They think everything is one problem. So tarsal tunnel syndrome. You want to talk about the nerves, what they're called, where they go, how they're tractioned, and how it relates to peripheral neuropathy and more.
Absolutely. So yeah, just as you alluded to, we have a large peripheral neuropathy patient population here at Power Health. Our approach to peripheral neuropathy is unique in that we try to, if we can, we properly select candidates for our program. We cannot help, in our opinion, everybody with what we do. But what we have observed is that if there is a definable metabolic condition that can be rectified in conjunction with peripheral nerve stimulation, we use a lot of electrical modalities, then lots of times our patients tend to get more sensation back, and many times their symptoms tend to be alleviated. Now, in the diagnostic workup of peripheral neuropathy patients, we frequently see that many of them have tarsal tunnel syndrome. And it may be as a consequence
in addition to the peripheral neuropathy metabolic issues. Those metabolic issues could be inflammation, they could be thyroid, they could be diabetes, as everybody knows. They could be insulin resistance, as most people don't know. You could watch one of our other presentations. But yeah, they have tarsal tunnel in addition.
And it could be possibly due to the muscle tone and the feet starting to go away a little bit because of the peripheral neuropathy. And what happens is, just like we know with carpal tunnel syndrome, you talk about, everybody associates, oh, I type too much and I get carpal tunnel syndrome. Well, relative to tarsal tunnel syndrome, many of us, our feet tend to flatten out when we walk, and that can excessively traction the tibial nerve as it goes through this little space in the ankle termed the tarsal tunnel. And so that traction can lead to nerve irritation and exacerbation of many times pain and burning pain on the bottom of the foot. The reason, in our opinion, and the neurology textbooks will substantiate this, is that tarsal tunnel syndrome is not always diagnosed properly because it oftentimes won't show up on a nerve conduction velocity test or EMG test. Many of you have had those. It's basically where they put electricity into your leg to see how fast the nerves are transmitting impulses, as well as how the muscles are firing down there. They stick a little needle into your muscles. Some really good electrodiagnosticians can pick it up, but with the routine electrodiagnostic testing, lots of times it's missed. And so, interestingly enough, tarsal tunnel syndrome is diagnosed based on some pretty crude examination techniques, like
pretty simple
tapping a reflex hammer over the tarsal tunnel syndrome, or applying pressure with one's fingers to the tarsal tunnel syndrome for 30 seconds and see if that provokes the person's symptoms. So you can look up those tests if you want to, but just know that for those out there suffering with burning, tingling, and numbness on the bottom of their feet, it can be a number of things. We've talked about at length. It could be anything from a brain tumor to your neck to your lower back to frank peripheral neuropathy to tarsal tunnel syndrome, or a combination of one or all of those. We have seen those cases. So that is what we have to say about tarsal tunnel syndrome.
Frequently misdiagnosed. Frequently misdiagnosed as plantar fasciitis.
Mm-hmm.
But if you got flat feet, your shoes are wearing off the side, you have those symptoms, start thinking tarsal tunnel syndrome.
Exactly. And make sure you're with somebody who knows how to make a proper orthotic, who's not just taking you to the bank, and who knows how to get rid of the tarsal tunnel inflammation.
Yeah, we've used the orthotics and the
very successfully.
And the laser and a couple of other things. It's not that hard to take care of.
Yeah.
Well, but you gotta get it diagnosed.
So if you want to go to any more information we have on peripheral neuropathy or other health topics, go to powerhealthtalk.com. And thank you for watching.